Good morning.
Hi. Good morning.
Today you've announced plans, if you were in government, to spend on providing 1,000 extra hospital beds, fully staffed. You say it will cost £280 million up front, plus 400 million each year. That's on top of 8,000 new general practitioners and unspecified amount you want to spend on repairing hospitals. Did you find the magic money tree down there in Dorset?
Well, first of all, Trevor, can I thank you for taking me from Dorset, because it's meant that I can take some time with my family here at my mother-in-law's. But in terms of our health policy, we're putting health and care right at the centre of the Liberal Democrat election campaign and manifesto, which we'll publish early next week. And when we do that, you'll see that everything has been fully costed. And we've been, as you've rightly said, throughout this campaign, we've been announcing a number of our health and care policies, whether it's more GPs, whether it's more beds, whether it's supporting carers. And each time we've done that, to be fair to us, we've said where the money is going to come from. So on the care policy, free personal care and making sure we've got more care workers by paying them properly, we've said we would reverse the Conservatives' tax cut for big banks, and that would raise £4.3 billion. When I talked about mental health for young people and children, we said we'd increase the digital service taxes on the social media giants, the likes of Amazon and Google as well. So I think it's, unlike the other parties, we've actually already begun to show very clearly where the money from for our health and care policies would come from. It's really important because NHS and care needs a significant boost. It's in a real crisis at the moment, and it has to be the priority for people, their families, their communities, and indeed the country. It has a big impact on the economy, actually, and that's why we're making it so important.
This is an unfamiliar situation. Now, I can't remember how many general elections I've covered, getting on for a dozen, I suppose. And in most of them, Liberal Democrats could be counted on to say one thing, which is that you're going to raise taxes on personal incomes to pay for something in health or something in education, and that you would criticise the other parties for being dishonest about their spending plans. Are you sure you're not joining them?
Not at all. The reason why we're not going to increase personal taxation is the Conservatives have already done that, and they've got eye-watering plans to continue to do that into the next Parliament. And when people are suffering with the cost of living, with high energy bills, with rents, with mortgages, with food prices, I think even higher taxes is just the wrong thing to do. So we have looked around really carefully at the sectors of the economy where there are companies and banks and so on who are actually doing incredibly well. So we were the first party, for example, to call for a windfall tax on the oil and gas companies, because we could see their huge profits based on the rise in oil and gas prices when Putin invaded Ukraine. So we've tried to make sure that the tax system is going to be fairer, and that means not more taxes on people. They're paying enough already, but taxing things like the banks, the social media giants and the oil and gas companies.
OK, well, let's see if it actually measures up to the task. The Health Foundation said last year that under the central projections, an additional 23,000 to 39,000 beds would be needed in 2031 to deliver 2018-19 rates of care. That actually you would need, getting on for 40,000 beds just to return to where we were in 2018 and 19. Your 1,000 really won't make much difference, will it? I mean, is there any point in this other than to get a headline?
Well, Trevor, I haven't read that report, but what I can say, and I don't think whether the report would have looked into this, one of our key messages this election is to make sure that people can get care in their homes and in care homes, more care home places. And we're doing that in a number of ways. We're saying there should be a new national minimum wage just for care workers of £2 an hour above the national living wage, because we've got a huge shortage of care workers, which means people aren't able to get care in their homes where they prefer it and their families prefer it, and it's better for them. And if we did that, what a lot of experts have said is you'd free up a lot of hospital beds. People could be discharged when they're ready to be discharged, get the care where they prefer it, and that would have a big impact on the NHS. So I think sometimes one needs to look at a comprehensive look across the health and care system. It's one of the reasons why we've talked a lot about care, more than I think any other party, particularly on social care, because I think when people look at that, they realise that you can free up a lot of beds through policies like we're proposing.
Yeah, I was interested in this. Your deputy, Daisy Cooper, in debate the other night, actually talked about this policy. I did a little bit of arithmetic. There are 1.6 million people working in the health, in the care sector. You add the £2 an hour, you're talking about £5.5 billion more in pay. But over and above that, what we're talking about is something else, migration. There are 300,000 foreigners who work as care sector workers. There are nearly 200,000 vacancies. So how is this going to work? You're going to spend another £5.5 billion and you're going to have to find, 200,000 more people from abroad to work in this sector? How does that add up?
No, I'm really glad you've asked that question, Trevor. Let me take you through it. I don't recognise the £5 billion figure at all. Independent experts we've talked to think that our figure of £1 billion, which we're putting into our manifesto costings, is actually quite generous. So I think actually the pay figure that we've got is the right figure based on what experts tell us. But one of the reasons why we think the Conservatives have got things so badly wrong is they've been relying on people coming from other countries. You're right, they've issued hundreds of thousands of healthcare visas, and those people are doing a fantastic job, and I think we should recognise that. But imagine if we were paying care workers more. I don't think we need to issue all those visas, because I think a lot of people in this country would be more willing to work in the care sector. You think an extra £2 an hour will get you 300,000 people into a sector which, literally, I mean, on your broadcast this week, which if I'm just as a professional, I must congratulate you on, you demonstrated vividly how difficult that job is. An extra £2 an hour, is that going to get another 300,000 people to join that workforce? Never mind the 200,000 vacancies. Well, let me take you through it, Trevor. I'm really pleased you're asking me about this, because it's so important that people understand how dire the situation is at the moment and how we need action. And I'm really proud that only the Liberal Democrats are doing that. But let me take you through the analysis.
If you don't mind briefly.
If you pay this extra money to care workers, I think people would make a choice of not, say, working in supermarkets or Amazon warehouse and things like that, because they would feel that the tough job of being a carer will be properly rewarded. And you talked about our party election broadcast, where I did open up a little bit about what it's like being a family carer. Be clear, there are millions of people who have similar experiences to me and my family, where they're doing a lot of the caring. And one of the things we're saying, this is really important, Trevor, if I may, if we support carers who are caring for their loved ones at home, actually a lot of the caring will be done by families. If you're really more generous with respite care, with carers allowance, with helping people into work as well at the same time, so they can balance caring and working, we've got a full package. So it's about paid care workers, paying them better and valuing them more. It's also looking after the millions of family carers.
OK, so Ed Davey, I'm so sorry that we have to cut this short, but we have to return to Greece. But thank you so much for your time this morning.
Thank you.